Hello everybody, and welcome to the chapter on immunologic emergencies. And in this chapter, this is basically about the body's immune system going rogue, so to speak. So with that being said, we're going to get started. So at least 1,500 Americans die annually of acute allergic reactions. Allergy-related emergencies can involve acute airway obstruction, cardiovascular collapse, and distinguishing between the usual response to stings or bites and an allergic reaction can actually save a life. Talking about the anatomy and physiology of the immune system's job is to protect the body from foreign substances and organisms. Without an immune system, we would be under constant attack, and almost any substance can trigger an immune system and cause an allergic reaction. A little more on the anatomy and physiology. The allergen is defined as the antigen or substance causing the allergic response. This tends to include the venom from insect bites and stings, certain medications, plants, foods, or chemicals. The injected and inhaled allergens tend to cause the most severe reaction, and that's mostly due to the fact that it's got a direct pathway to the bloodstream, which allows that particular substance free access to the rest of the body, instead of the contact allergy where it's localized just to that particular source of contact. All right, so when a foreign body actually gets into the human body, the immune system responds likewise. So the primary response is the body mobilizing white blood cells, which are called macrophages. These macrophages greet, which means make contact. It will chemically kind of determine whether or not this is a foreign body or something that should be removed, and then it engulfs this particular structure. And so that could be any number of cells, bacteria, virus, or as in the case of a lot of allergens, proteins of some sort. And so then if the body can't identify that substance, the immune cells record proteins on the surface, and then they design an antibody. The antibody match up with the antigen and then will inactivate it. So think of it as a receptor and key site, and in the way that these two kind of come up, and it's very similar in response to what you would kind of assume with acid and base. If you had, say, vinegar, which is acetic acid, and then you added sodium bicarbonate or baking soda, the two will neutralize one another and create that neutral balance. Through the body's primary response, the body can develop a sensitivity, and the body will place antibodies on basophils and mast cells. And there are many basophils and mast cells located throughout the body. The mast cells tend to really kind of concentrate in connective tissues, the bronchi, the GI mucosa, and other border areas in which are most likely to come into contact with these foreign bodies. So it's kind of think of it along the lines of the front lines being prepared for battle. So diving a little bit deeper into the basophils and the mast cells, both of these cells produce chemical mediators to particular antigens. They launch and maintain the immune response, and then they will also chemically signal for the white blood cells or the macrophages to kind of march in and take over some of the battle. And by doing so, this increases blood flow to the attacked area. And if you're looking at the picture here with the bee sting, you can see that the stinger is releasing the antigen or the offending body, right? In this case, it would be a small dose of poison, and the body is now recognizing that this is a foreign body, and it's going to cause either one of two responses, which is the intended response, which would be immediate pain and inflammation, or the overdriven response, which would be anaphylaxis, which is the entire body kind of going into massive over defense of a small amount of this antigen. So the mast cell there is releasing the chemical mediators, which is trying to, again, neutralize the offending agent, and then it's going to ask for the backups or the reserves with the macrophages to come and kind of envelop that stuff. So if you're looking at this, you can see that some of these chemical mediators will tell the lungs to bronchospasm, and then they will also vasoconstrict. And this is really to make the lungs produce mucus, because again, it's now thinking that this particular foreign body is coming into contact with the tissue that it normally would, which would be an inhalation or some kind of injection. So the lungs will produce a little bit of mucus, they will broncho kind of constrict or bronchospasm, and then vasoconstriction in the lungs. The heart will actually start to get a little decreased cardiac output, which is going to decrease the coronary blood flow. This comes with a little bit of increased cardiac. This is as a result of some vasodilation, which is going to take some pressure out of the system, and without the proper amount of pressure, we're going to get that decreased cardiac output. Now, on the flip side of this is when we have a vasodilation, you can absolutely expect that you're going to have some leakiness, right? And so that's some of that blood plasma or the interstitial fluid is going to kind of third space in between the cells, and then the skin will resultantly react with pruritus, which is the Latin term for like an itchy sensation, or urticaria, which is the Latin term for hives, and then you'll get the edema, which is that swelling. So when we're dealing with these chemical mediators, these are really, really useful in small areas. So if you have perhaps a allergy to something that you would inhale, and just a few pieces of particulate came into the lungs and got deep enough into the bronchioles that perhaps maybe they got close to an alveoli, if the body immediately responded in just those small kind of like, we'll just use pollen as a invader, and enveloped that pollen and then covered it in mucus to kind of keep it from making its way into the bloodstream, you could kind of expect that you would end up coughing, right? And so it's useful if it's maintained to that kind of stuff. When it's dangerous is when the entire body goes into reaction mode and these things start to actually kind of cascade. And so then we get widespread response to a very small antigen. And unfortunately, this kind of becomes a negative cascade of events. So as more and more of the blood flow gets vasodilated, we get that hypotension, and then if there's more and more leakage, we're losing even more of the actual fluid. So you can see that this will kind of compound itself, and then we get into a kind of a hot mess. So for the most part, the body will produce its own vaccines, which is the immunity to most things that it has determined is foreign and should not be in the body. And anything that isn't, modern science has developed a weakened form of something like that, or a dead and inert form of an offending body, which is how we create vaccines. In the case of the body will develop these antibodies, right, which is the chemicals or the structures that are going to neutralize the offending agent. The invaders are then kind of disposed of by the macrophages. And then if the pathogen enters the body, it's already kind of accustomed to this. So think of it as if you knew that you were going to get shocked by touching the light switch because you had already experienced it once, you would be much more adept at either not touching the light switch or turning the light switch on with something else. So as these are recognized, the antibodies are manufactured and then they're sent out to kill that offending agent or to neutralize and then remove it from the body. The secondary response becomes that acquired immunity. So when we develop a vaccine for any of the flus or any of that kind of stuff, we'll say polio or measles, mumps, rubella, that is an acquired immunity, and that's when you have not actually had to experience that disease, much unlike a natural immunity. And so we can use a little bit of context here, and we can go backwards, not actually that far, in which most parents would allow children to come into contact with other children to say spread the chicken pox, right? And so what they were trying to do was, for the most part, chicken pox, if experienced by a child, is a rather uncomfortable and unpleasant experience, but very rarely was it life-threatening. The good thing that came about that was that the body would then recognize this particular virus, and then it would mount an immune response that while this particular, the chickenpox virus is never outside of the body, the immune system can kind of keep it in check. So once you've gotten it, you've always had it. And now in modern era, instead of giving children the terrible experience of having to go through the chicken pox, they've developed that vaccine. So you can get the acquired immunity by taking the vaccine, or you can have the natural immunity by having experienced that, and the body will recognize both as the same thing and will forever have that response. So now we're going to talk about the allergic reaction versus anaphylaxis. And we can make this really simplistic before we get deeper into the lecture. An allergic reaction is a little bit of a elevated response to a stimulus, whereas anaphylaxis is a systemic response to that same amount of stimulus. And obviously, a little of something is okay, but more of something is not necessarily okay. And in the case of anaphylaxis, it's definitely not okay because it starts to degrade so many body systems to such a degree that it actually becomes a life threat. So as we're defining different types of allergic reactions versus anaphylaxis, we're going to look at a mild allergic reaction. And we're going to say that that's localized hives, the itching, or the tenderness. And that again is the invading protein or substance that's, say inside the skin, if we're going to use the bee sting again, where that poison enters the skin. It is designed to trigger this particular response for the most part. Now, how well the body deals with it is what's going to create whether or not this is just the intended action or if it is becoming an allergic reaction. And so in the case of, say, a particular bee sting, you have somebody who has no real sensitivity to it. They may have a localized wheal.
Ooh, you got some pie, eh? Can I have a piece?
Sure.
Ooh, let me have some of that Cool Whip.
What'd you say?
You can't have a pie without Cool Whip.
Cool Whip?
Cool Whip, yeah.
You mean Cool Whip?
Yeah, Cool Whip.
Cool Whip.
Cool Whip.
Cool Whip.
Cool Whip.
You're saying it weird. Why are you putting so much emphasis on the H?
What are you talking about? I'm just saying it. Cool Whip. You put Cool Whip on pie. Pie tastes better with Cool Whip.
Say whip.
Whip.
Now say Cool Whip.
Cool Whip.
Cool Whip.
Cool Whip.
Cool Whip.
Cool Whip.
You're eating hair!
Which is, a singular kind of inflammation spot. Whereas somebody with a mild allergic reaction may have hives within, maybe say that extremity or a large portion of skin, right? It's not really all encompassing and it's not really spreading. It gets into a little bit more of a severe allergic reaction as this kind of involves more body systems. So instead of just the pain and the swelling and the itching associated with that particular sting, the entire body now is developing these hives or urticaria, and then as the body kind of vasodilates, we're going to kind of get a lot of edema associated with that. And then the respiratory component, where the bronchospasm starts to happen, we get the mucus really into production, and this is closing down airways and will ultimately end up in some kind of respiratory failure with hypotension. Hypersensitivity is just the exaggerated response to the stimuli. And then really shifting gears into that anaphylaxis again is the extreme response. It doesn't always have to be life-threatening, but it's going to involve multiple organs. So by definition, anaphylaxis is going to have some kind of respiratory component and some kind of cardiovascular component. And so in class, you'll hear us talk about it being anybody that has, say, wheezing associated with urticaria or the hives, and then we're starting to see any kind of potential for hypotension, we should already be geared up for anaphylaxis. We don't want to wait until we have such a significant amount of swelling that it's starting to try to block off the airway. If we've waited that long to treat it as anaphylaxis, we're way past the ability to actually help that patient. effectively. Kind of hash over this immune system response. Again, we really have to have an immune system because there are more life forms on your body right now than there are in comparison to different life forms on the planet. So that being the case, you can imagine that without something to kind of fight off these invaders, they would quite literally just multiply and overtake your physical body to such a degree that it would actually be detrimental to life. And so the whole reason for you to have this immune response is to make sure that you can kind of keep things in check, and there can be certain things in certain areas that the body feels like it's, say, a symbiotic relationship, right? This would be the bacteria and the GI. Or would recognize, say, that same bacteria in the bloodstream and say that that's not appropriate and sent in to neutralize and remove it. The resulting ranges and severity, it really depends on how the body kind of reacts to this particular substance. And what everybody should know is that while you may not have had an allergic reaction to something, say, over 30 or 40 years, you can literally just flip a switch and become allergic to a point of anaphylaxis to almost anything at any given point in time. And that's not to say that anybody should be in fear of eating peanuts if they've never had that. For the most part, the body's really adept at figuring out what is a potential pathogen or a potential invader. And it's just in the rare cases where the body kind of sees something and it really kind of has that inappropriate response. Now, talking a little bit about mast cells, when mast cells recognize the invader and they release their chemical mediators, we initially get that histamine response. And this is what causes the blood cells to dilate and the capillaries to leak. And part of this is to allow those macrophages, or the white blood cells, out of the bloodstream into the tissue. Because if you guys remember, we were talking several lectures back, blood products outside of vasculature are pretty necrotic to tissue. And so that's not something that we want. We don't want a whole lot of leakage. And so we want to keep red blood cells where they're supposed to be, which is in the pipes, right? But in the case of these white blood cells, we want those to leak through the vascular system into the actual area that was offended. And so by doing that, you're allowing it direct contact with the offending agent. The leukotrienes are a little bit more powerful, and they cause additional dilation and leaking to allow more of it. And that's really what's happening around, say, like a hive. When you get that kind of inflamed, raised section of skin that's now becoming pink, that's because of the massive amount of blood flow that is around this particular area where the body says that there's an invader, and it's allowing all these other products in to try to neutralize that invader. Talking a little bit more about that histamine release, again, we're still talking about an immediate vasodilation, and then we get that vascular permeability. Again, this is really to let those white blood cells do their business. We want any of those offending products to be neutralized and removed, and then we get smooth muscle contraction, and then there's some decreased contractility of the heart. The leukotriene response causes some further respiratory compromise, which is going to be that mucus production and the bronchospasming, and then it kind of also worsens the cardiac condition, which will increase the state of hypoperfusion because of hypotension and the inability for the heart to kind of override what's going on in regards to pressure and flow. So a little bit more about the symptoms of allergic reaction and anaphylaxis, and just remember, an allergic reaction is an elevated response to a localized offending agent, and then anaphylaxis is an overdriven complete body reaction to this. And so again, we have the pruritus, which is the itching, the vasodilation, the hypotension. You can have laryngeal spasm or bronchospasm, and then myocardial irritability, and that's due to the decreased ability to perfuse itself. Abdominal cramping and bloating, and this is because remember where a lot of these cells live is along the GI tract. some flushing, headache and dizziness, runny, itchy nose because we're trying to build some kind of mucus production to block and surround the offending agent, and then swollen eyes, which is just the capillaries and things of that nature vasodilating and allowing that interstitial fluid into really thin skin. And so when we get a little bit of swelling around the eyes, it becomes very obvious because of how thin that tissue actually is. There's not a whole lot of thick muscle or any of the fat stores in the eyelids or immediately surrounding the eye socket. So if we're talking about clinical symptoms of pure anaphylaxis, the skin is going to be warm and flushed, and that's because of the massive amount of vasodilation, and then we get that leaking. So these people are going to be radiating a lot of that core body temperature because the blood is no longer in the vascular system. Again, that itching, the swelling, the patients will start to become short of breath and have the signs of dyspnea, and they will often complain of tightness in the throat and the chest. If we hear any kind of wheezing, we know we're there. That should be a very telltale sign for you. Even if you only have just a few small sections of hives, if your patient is now wheezing, they are clinically decreasing their ability to have normal respiration, and they are dangerously close to tipping over the edge. We can get into the gastrointestinal symptoms, which is again that abdominal cramping, the nausea, the bloating, the vomiting, some distension, and diarrhea. Again, that's the body trying to kind of void anything from the GI tract because that offending agent may be in the GI tract. The central nervous system can cause some headache, dizziness, confusion, anxiety, and the sense of impending doom is often as a result of any kind of decreased O2 saturation, right? That person now has a fear response, which is appropriate considering that their inability to breathe or their hypoperfusion causing any kind of hypotension.